Today's topic is somatic therapy, and couldn't be more thrilled to talk about something that is huge and up and coming in the world. Not just mental health therapy, but you're starting to see it come across all different fields. We're talking about somatic therapy. Hey, humans.
I think a lot of what we were just talking about, and I sent you some questions earlier today where I was like, hey, this is such an up and coming topic. A lot of people have questions about it. And within my practice, I know I refer to you a lot. I mean, I pretty much refer to you exclusively. And I'm like, yeah, you got to go see Jenny Poole because she does somatic therapy. She's a body worker. She went and got her massage license so that she could do somatic work, so that she had permission to touch people. And like when they hear that, they're like, oh, well, what is that? What I've heard of EMDR, but I'm like, Jenny does brain spotting and Jenny does body work. She does somatic work. She's the best. I send you a ton of people.
You do.
And you take really good care of my people. So thank you.
Let's talk about what somatic therapy is, though, because there's a huge wave of it coming into the world. You're starting to hear a lot about somatic therapy and people asking for somatics. Do you do somatic therapy? And there are so many modalities that even you can do with somatic therapy that don't require a hands-on approach. You talked about EMDR, brain spotting. Those you don't have to have any kind of a hands-on approach because that can be a tricky place for a lot of therapists to traverse.
Yeah.
I definitely wanted to get my license and be able to do structural bodywork because I knew that one day that these disciplines would have more cohesiveness.
Yeah.
Which is beautiful because it helps move the needle on healing.
Yeah. And when I was in my training as an acupuncturist, somatic work was just starting to bubble up. And right after I graduated in 2014, I worked pretty hard to get myself into a VA medical center. And I was especially excited to work with a woman by the name of Elaine Duncan, who has done a lot of studying under Bessel van der Kolk and Peter Levine. And she's just an earth shaker and a mover. And I learned a lot about somatic work from her. And I saw her applying these principles with our veterans, and her work was powerful. And it just involved like a touch. Like this is sometimes all it takes to bring somebody down. But by and large in medicine nowadays, we don't have permission to touch from a psychological perspective. Like if you're going to go get your LCSW or your psychotherapy license, you don't have permission to touch your patients.
Right. But look at the energy at which you came. That was such a good example of what it means to just have therapeutic touch involved in any kind of therapeutic experience. Even when you're showing care and concern, just the, hey, I'm here.
Yeah.
And this isn't invasive. And also obviously consent, like, hey, can I help support you? Hey, can I reach out? Can I touch your arm here?
It's so important.
And someone saying, yes, please. And you're not wrong, is that somatic therapies don't have to be complicated. They don't have to be complex. And that the heart of what some of them do is help people get back to feeling connected, right? Connected to themselves.
Yeah.
Connected to care outside of themselves. Yeah. Versus the danger zone. Yeah. Versus a fried nervous system and afraid fight or flight that's just constantly in fight or flight or freeze.
Yeah. I'm so glad that we started out with this subject because as an acupuncturist, I get to touch people all day long and it's beautiful. One of the things that I do is I will assess the pulses, and it never fails. As soon as somebody lays down on the table and I walk over and I grab their hands and I'm like, hey, just relax. And they'll hold their hand up like this. And they're like, I am relaxed. And I'm like,
you're not.
Just relax, relax. Okay. And then we start to listen. We start to listen to one another in a way that is really quite special. And it brings the person down. And in my experience in working with our future medical providers, this kind of thing is not taught. We don't get this when we go to see the doctor. And so
you get a cuff and a machine.
Right. And we don't get this when we go to see our therapist, but you get that sense of touch and that sense of acceptance and welcoming and like, oh my gosh, somebody's touching me. I mean, think about when you were a baby. You got touched. Most of us got touched and held as a baby. And so that thing is very primal.
To be fair, too, if you didn't get touched, especially when you're a baby, then there's problems.
Oh,
you're going to have problems. So to your point, touch was necessary to help create safety, connection, and love,
regulation.
Little,
yeah.
And even just the way that the therapeutic touch and the therapeutic exchange that just happened there, as you hold my hand and you start taking my pulse, there's a gentleness to it. And there's this feeling that goes, I'm going to get some help. Right. Yeah. And that's all happening without a verbal exchange other than I'm checking your pulses. So it goes without saying that most of our communication is nonverbal. But sometimes we so heavily rely on what we're saying verbally.
Yeah.
But that's the beautiful thing about somatic therapy. And that's one of the things that I teach the therapists I work with is when you learn how to do somatic therapy or you're using somatics, you start to learn attunement. Yeah. So I can watch somebody's pulse change when they change from being in a space of being calm or distressed. So if they start talking about something that distresses them, not only will their eyes move, sometimes those are telling their story to different places, but tension in their face, tension in their neck, tension in their hand. You can just see, if you know how to look for it, tension in the body. And that's telling you that I have something that I can then release in the body.
Yeah.
And not just through talking. Now, let's talk about how important it is to talk about things. Well, of course it is. Talk therapy has its place, and being able to talk about what happened to you, especially if you didn't have a voice, now you get to have a voice. There's an unencumbering that happens and a freedom of saying, I felt like I didn't have a voice. I felt too scared to say anything. And now I have a voice, right?
Yeah.
Like, you get to get it out. So I'm not saying that it doesn't have a place, but where I think that somatics is really going to continue to take off is that creating that voice, telling the story, seeing seen, heard, and validated like we need to as human beings. Now we also remove any kind of somatic imprint that started to essentially get recorded on our body. These bodies that we have are big, huge recording devices. They will record literally every experience you've ever had.
Yeah.
That's why people oftentimes when they have surgery will wake up and they'll be in tears and they are in tons of pain meds. They're not hurting, but while their conscious body didn't know that they were getting cut into in some way or the other, their body did. And so oftentimes they're waking up and they're having a response because they need more pain meds or they're in pain, but because their body knows something happened to us, even if it was a good thing, like my knee needed to be repaired, but it got cut into.
Yeah.
And my body knows that it got cut into.
Yeah.
Even though my mind went asleep.
Yeah. And if you think about, if we observe an animal in the wild and the animal successfully escapes its predator, that animal will do something to shake it off. It will bound, or it'll wail, or it'll shake, it'll scream, it'll do something to shake off the threat of annihilation. And like our bodies are similar too, but we live in a culture that's kind of said to us like, hey, you got to keep it together.
Yeah. If you're in distress, I need to calm you down as fast as possible so you stop having distress versus shake that off.
Hold them down. Even the ambulance.
Move your body as much as you need to. Don't stop that. That's good for you. You're not hearing those messages usually. It's like, how can I calm you down as fast as I can?
Yeah.
Because you're distressed and now I'm going to start distressing me and I don't like it versus, hey, shake that off. Like, get that out of your body. If your body needs to unwind, let it do whatever it wants to.
Yeah.
So let me give you an example of that. It was in my brain spotting training, which we'll talk about what brain spotting is. It's, I would say, somewhat of EMDR's cousin. And I was working with a gal. We were practicing, and she had been in a pretty bad horseback riding accident, so bad that she ran into a fence and the horse and her got tangled up in the fence. God. And as she's unwinding, now again, this is all hands off. And as we found her where in the eye field the brain spot was held and where all that trauma memory was stored, and as we're unencapsulating it, and she's kind of, when you're brain spotting, you can hold your spot and you can also go with it. And you're kind of like unwinding, letting the body unwind while you're doing some breathing. At one point, she started doing this. And she's like, and then she opened up her eyes almost and like, what is my body doing? I'm like, don't stop it. It wants to unwind. But it was unwinding and it looked like she was riding a horse.
So interesting.
Because the somatic imprint of that day was she was on a horse. And so I said, just let your shoulder kind of do it at once. And at first, because when we're unwinding, the body is trying to untangle, that movement feels weird. And sometimes we then try and manage not just our perceptions of that, but everyone else's perceptions of that. And that's sometimes where the interruption happens.
It's like,
the
body, I'm acting weird.
Yeah.
I have to like push it
Stop
down
it.
again. Like
Yeah.
everybody's told me my whole life, push it down.
Yeah. Versus
Don't be weird.
the body's an intuitive vessel. And if you give it the doorway to unwind, then it just will organically will, because now we're not in the way of it.
Yeah.
And so she eventually just let it unwind, and she had taken the blow all the way to this side of the body. And then it was significant, the repair that needed to happen to her physical body after all the injuries. So again, that somatic imprint is recorded. And if you only talk about something, but you don't let the body discharge all of that survival energy that built up, and this is where we talk about fascia, right? The fascia is the matrix of the body that structurally holds us together. It holds our organs together, our muscles together. It's what's wrapped around our whole body.
Yeah.
And I truly believe that so much emotional debris can get stored in the fascia.
Yeah.
And as you start unwinding someone's fascia, and you can do that even just with those gentle touches, is that you can release so much emotional debris. And sometimes it's the simplest touch that can then, it's like a ripple in the pond. If you touch the pond, it doesn't just have one ripple and stop. It ripples out. And that's what the body will do. If the body has room to unwind, it will. And it will just do it.
I'm going to say something else about the fascia and how it relates to Eastern medicine and this concept of the acupuncture points. And where the points are located, we've been able to successfully show, doing examination of the fascia, that the acupuncture points exist on the fascia where there are collections of nerve and vessels.
That's cool.
And so you start to think about how interconnected your body is. If the fascia is wrapping every muscle, every bone, everything in your body, then hell yeah, you're an interconnected network. And it's why I can put a needle right here and have it affect the other side of the body all the way down close to your feet. So your body is one very interconnected highway.
So yes.
Of information that's constantly communicating with itself.
And when I'm explaining somatic therapy to people, because it's a very new concept for some people like, I've never even heard of this, is I help them understand that, do you believe that your cardiovascular system, your heart, works in sync with your lungs? Like, so your heart pumping is a part of you having respiratory, like breathing, but then also your digest. Like, if you can accept that the physical body works in sync with each other, and that one couldn't really work without the other. We can't just be like, hey heart, I just kind of want you to beat right now, and hey lungs, just you can take a break and just do these other systems. They all just work in unison with each other.
And you'll learn that in any anatomy and physiology course that you take in any medical education program.
Yeah,
for sure.
So then plug in the belief that then why isn't the emotional body, the mental body, and the physical body then also working in sync with each other? And when you're having physical and emotional debris, like when you have emotional debris, it's going to affect the physical body. If you're having an emotional distressing experience, it's going to affect the fascia, what creates tightness in the body.
Because the emotions affect the limbic system in the brain. The limbic system will drive your biochemistry. The biochemistry drives how you exist inside of your body, and the chemical soup. It's your medicine. It's your brain's own medicine that's getting fired, and it will fire quickly, and things will change really fast in the presence of an emotional upset.
Yes. And here's two examples, and one's a little bit more benign and the other one's more significant. So I was working with a little one, 11-year-old, and they were having so much stomach pain, so much distress in the gastric area, and couldn't have gone to more medical appointments to try and figure this out. No ulcers, no perforated anything, right? There was nothing medically like that was wrong with them, right? And so at one point, the doctor said, it's just all in your head. And that As a kid, we do the best we can with the information we have, but we don't have really great coping skills as a kid. And so I think that moment was, well, then I'm just weird because I'm really not feeling good. But this person is telling me that it's just in my head. And so what I had to explain to this little one was, well, sure, it's in your head. That's where oftentimes our emotions in our heart too are generated. We're feeling something, we're thinking something. Okay, but I said, one of the things I want you to understand so that you feel more validated is that you will have a physiological response to emotions that undeniably.
Yeah.
You watch somebody get mad, they're not just sitting there all like neutral in their body. If they're mad, guess what starts to happen? The jaw gets tight. The body starts to get tight. People sometimes ball their hands up in a fist. So as that anger is growing, this is just an example of that, you're starting to have a physiological response to the emotion that you're feeling. Same with anxiety. So anxiety is hitting, and in this particular little one, because anxiety, in my experience, hits up in here in the chest or right here when we process and digest, ironically, food. I really believe we process and digest emotions
Totally,
too.
the experiences.
And over time, there had been so much anxiety that literally, and I showed the little one this, I said, let me show you in your stomach how just tight your fascia is. I just knew. And sure enough, they were like, that feels like concrete. And as we unwound the fascia in the stomach,
so cool.
Guess what came after that? Emotional release. Tears and just all of the worries, all of the fears, and no more encumberment, no more being bound. And can you imagine all of that physiological response to anxiety had created so much tightness that of course the stomach was squished and there was a lot of acid reflux. Of course the liver and the organs and everything and the bowels were really squished because that's how much tension over time this little one had accumulated in their body. And it was literally like, and then it's like, and go to school and
be
do
good,
all your chores
get
and be
good
good
grades.
And the doctor said it was on your head. And so come on, you're fine. And those are conflicting messages because the little one, again, with very limited skill set to process all of this, is going, it sure doesn't feel like it's in my head. This feels really real in my body. So somatic therapy is so powerful because it gets from a bottom-up approach. So the talking, what's happening in the mind's important, but we get to where the release can happen, and then the rest can flow. And that's that cohesive progression that you want to see, so you can really eventually slough off the emotional debris and then reclaim safety and reclaim equilibrium in the body, which is ultimately what the body wants.
Totally. I want to reframe this concept of like it's all in your head. And I do think I know quite a few people that work in allopathic medicine, conventional medicine, osteopathic. We talk about our doctor, our primary care physician, and we're totally not here to hate on.
We love doctors.
Primary care physicians. My gosh, if you're in an accident, please go to shock trauma. Your acupuncturist is not where you need to go. But this concept of it's all in your head, like I grew up with that for sure because I had things that bothered me. I always had back pain. I always had stomach pain. I was always constipated as a kid. And like my parents were going through a divorce. And for sure, the doctors were like, hey, there's nothing wrong with your kid. It's all in her head. And I watched that diagnosis being given to my sisters too. And it was like, okay, now that I do what I do and I understand where the limbic system is in the brain.
Right.
For sure, there is a huge component about it affecting and triggering things that literally are in your head. It doesn't mean that it's all you're making it up. It doesn't mean that you're crazy and that you just need to shake it off and get over it. It means that something is wrong. And that instinct that you have, that instinct that we have that reads a room and says something is not quite right here.
No.
There's a couple of different things going on there. It's either that something is really, really wrong or that something is trapped.
Yes.
And
your body knows it. It's an intuitive vessel, and it wants, and then ultimately, especially if we eventually have the bandwidth, well, sometimes we don't have the bandwidth and it shows up and we're like, well, we got to push that back down. Or if we have the bandwidth and the window of tolerance to process it, then we can really create some deep healing and repairing.
Yeah, totally.
So here's the other example I want to share because it goes right along. And this one's more benign, but this teaches about the power of how the body keeps score. Bessel van der Kolk, he is an incredible, I mean, the book that he wrote is such an incredible resource for the world, and it will continue to ripple into and be connected to somatic therapy for decades, hopefully decades and centuries to come.
Everyone who is alive right now needs to read that to understand.
And if they don't read his book, he has now hundreds of YouTube videos. If you're not familiar with the name of Dr. Bessel van der Kolk, look him up because he is one of the giants. There's a lot of giants there, but Dr. Peter Levine, Dr. Gabor Mate, and Dr. Bessel van der Kolk are some giants that I built the way that I do somatic therapy around. So Dr. Bessel van der Kolk is one of the ones that I refer to. I said, don't take my word for it. I'm just some therapist in Utah.
Right.
Listen to this guy.
Go listen to this guy. He's done all the research.
He has a big
60
voice.
years
Right.
He started like a long time ago figuring this stuff out and observing it himself, collecting the data, putting it into the greater knowledge that we have about mental health. And he's come out with these somatic tools that are, I think, so much more effective than what we've had in the past for helping people with mental health.
1000%.
Yeah.
In the therapy world, if you hear Dr. Bessel van der Kolk's name, you know that, the body keeps score.
Right.
And now you're starting to hear that as a catchphrase. We talk about things that are stored in the body, like, the body keeps score. The body keeps score. I'm like, yes, it does.
Yeah, it's such a tagline now.
And it's beautiful. And I hope that it continues to ripple into the world. So this is a beautiful example of something that's more benign in someone's life. It's not causing this, it's not plaguing them. The experience isn't something that they even remembered in their conscious memory until it was brought up by me working on.
Yeah.
And this was strictly more of a bodywork appointment. I wasn't even doing any necessarily mental health connected with it. Someone had hurt their leg and their foot was hurting. And I was just going to unwind the structural debris, right? The structural tightness in the muscles and the fascia and help create relief as we released adhesions. So as I went to work on the foot, there was a recoil. And it wasn't because it was the where I had started. It was almost like the act of starting to grab the foot had created that response.
Mm.
And this client looked at me and almost surprised, was like, I don't know why I did that. And I said, well, I'm also a mental health therapist, and that was what looked like a trauma response. So have you ever hurt your foot? Have you ever taken a blow there? Has there been any injury to that foot other than chronic use from the running that they have been doing? Not that I can think of. I said, well, let me gently come back in. So as I gently came back into the foot, this client said, oh my gosh, I haven't remembered this forever. When I was 8, I stepped on a hornet and it stung me.
Wow.
It hurt so bad because as a kid, if you guys don't know, a bee sting hurts, but a hornet sting is worse.
It's the end of the world.
It feels like you're slipping on a nail. And so it's not like this bee sting experience had forever made life debilitating. Okay, this wasn't a huge trauma or even something that was a trauma in this person's life. It was more of, I got hurt and then life went on. But because I was touching that spot, and this is the power the body keeps score, it will record every single thing that happened to it. And if it hurt you when it happened, it will record a somatic response to that.
Yeah.
So we slowly and gently unwound not just the fascia and the muscles, but also the emotional response that was coming up as this person remembered getting stung by the hornet and then being scared about getting stung more. And it was this whole live memory that then now at the time, at the age this person was at, was able to now process and resource better than an 8-year-old can and go, cool. I wasn't safe then because the hornet hurt me. I'm safe today. Yeah. And we're okay. And then after that, anyone could touch their foot and there wasn't that recoil.
You know what I think is really beautiful about this and specifically that moment? Your patient basically said to you oh my gosh, I'm embarrassed almost, right? I don't know why I did that. I'm sorry. Forgive me, right? But you said, hey, you know what? There might be something to that because your body is really wise, and your symptoms, they kind of know
Yes.
that something deeper is going on there.
Mhm.
So I'm always surprised by how much my patients will apologize for just simply being in the space. And I'm always like, no, you belong here.
Yeah.
Like,
It's okay.
take up your rightful space. Like, that's
Yeah.
why you've come to see me, because you're hurting, you're suffering somehow. And I want to know about every single little thing. And so being able to tell your patients, like, listen intuitively. And when you feel something come up, when you have this intuition, if a thought pops into your mind, that's so telling. And we're often, and like, we're given these messages all the time in our culture to be small,
Yeah.
like minimize. And I get that everybody wants everybody else to behave, and that we can't take that example and go like radical with it and
Sure,
be really big and loud and lose our, composure. But take up your rightful space in the world and acknowledge what your body is trying to tell you. Those are often the avenues to healing.
Mhm.
And I think as practitioners, it's really important for us to make sure we lay the groundwork for that when our patients come in to see us, because, man, that's where the gems are.
Yes.
Yeah. Well, thanks everybody for joining us. And if you want to connect with me, I'm at theacupuncturist_org on Instagram.
And if you want to connect with me, I'm at Mend, MEND, Mend Counseling Center.com. And also Jenny, JENNIE _pool, POOL. And that's my Instagram.
Thanks. See you next time.